Hi, welcome to our discussion as we talk about professional and clinical education offerings from the Partnership for Maternal and Child Health of Northern New Jersey. My name is Sarah Muller-Robbins, and I'm the Director of Clinical Education at the Partnership. We are gearing up for this year's 2024 Maternal Health and Perinatal Safety Symposium at William Patterson University on March 21st, just 1 month away. So I am thrilled today to welcome
Mhm.
one of the planning committee members, Nadia Primus, for a discussion about it. So welcome, Nadia.
Hi, Sarah. Happy to be with you today.
Thanks for coming. So Nadia, you are the Director of Quality and Patient Safety at Hackensack Meridian Health. Can you speak a little bit about your role?
Oh, of course, happy to. And I'm happy to be here with you today. This is my very first time, so I hope I do okay. So back to your question, in my role, I promote a culture of patient safety and evidence-based practices at our birthing hospitals. However, I'll be remiss if I did not say that the true heroes are our bedside clinicians who work tirelessly in performance improvement, incorporated into their clinical practices, which support the reduction of preventable healthcare errors and other factors that contribute to the unintended adverse events and quality outcomes that we often see in healthcare.
Hey, that sounds like a lot of work, but very important. But you also have a passion for addressing specifically perinatal health outcomes. So how do you see the symposium this year addressing some of these issues?
That's a great question, and one I welcome, because oftentimes when we think of perinatal health, we think of it as a singular event, right? But perinatal health outcomes, it includes the maternal mortality, neonatal mortality, and preterm birth. So it's all those things. And this also takes us up to 1 year post birth and all the providers who touch the pregnant person. So those providers, of course, they're going to include the nurses, the midwives, the physicians, the doulas, lactation specialists, etc. This year, the symposium takes us across that spectrum, and it also includes experts and topics that include healthcare policy and emerging practices such as artificial intelligence. And that's pretty exciting.
So yes, you mentioned how this conference is so unique because it brings together the nurses and physicians, midwives and doulas, community health workers, and even hospital administrators and academics and researchers, all the different people involved in perinatal health into one room. So as a nurse and a hospital administrator yourself, what value do you see in having all these multidisciplinary people together in one room?
So everything that you said resonates. And what comes to mind is an old African proverb. If you want to go fast, go alone. If you want to go far, go together. The disciplines you listed are all part of the team bringing together their expertise to care for the pregnant patient, the family, and ultimately the community. So, this setting, what I find unique and I absolutely love about it, it brings us together and it allows us to learn from each other, see each other's perspectives, and understand how we all work together to improve maternal health outcomes across the board in the hospital and also outside of the walls of the hospitals.
Yes, that's right. And I completely agree. And to be able to understand what everyone's role is and their perspectives can make a big difference in how we implement care. Um,
Absolutely.
so we have a lot of different speakers and different topics. Is there anything particular you're most looking forward to at the symposium?
Well, the symposium has so many great segments. I'm looking forward to the entire day on a whole. Um, Apart from the awesome lineup of experts, it's always a great opportunity to connect with colleagues and meet a few new ones. Dr. Oladipo's session, healthcare connections and the impact of AI on maternal health. That sounds pretty interesting to me. AI is here and it's going to revolutionize the way we care and we interact with our patients. The panel discussions, those are always great. because in those sessions, you're able to learn from the local leaders, you learn about their work, and we can bring those practices back to our different teams. So I would say those are the two areas I'm a bit more interested in, Dr. Oladipo's talk and the breakout sessions. But on a whole, all the topics and the experts that are lined up, it's going to be a wonderful and engaging day for absolutely everyone who attends.
Yes. Oh, I agree so much. And so they will be in the afternoon. In the morning, we have in our keynote speaker, we have a Dr. Zakiba Henderson talking about
Mhm.
her work on and the disparities and the maternal health outcomes and some really practical solutions and what we can do to address it. And then following that will be Linda Janet Holmes, who is a researcher and has written a book about so we talk about the future with AI and
Mhm.
what will look like perinatal healthcare moving forward. She'll talk about what lessons we can learn from midwives and our history of midwives, particularly Black midwives from the South, and the really incredible outcomes that they had, and the practices that we can learn today in modern day medicine. So incorporating the lessons from our past and from the hands-on
Absolutely.
work of midwives, as well as incorporating AI as we do move forward. So I love that combination of this year's symposium. And in addition, we have three breakout sessions, and I know it's such a challenge to choose between them because we have Kathleen Hoke talking about policy and how it impacts law and policy, how it impacts maternal health
Mhm.
outcomes. And we have Dr. Nadrick talking about fatherhood and perinatal mental health when it comes to the fathers. And then our third one is Dr. Nastasia Harris from the Perinatal Health Equity Initiative. It's about hospitals and the community can really work together for outcomes and have that continuity of care. And what I do hear from people who come is you have such great breakout sessions. How am I going to choose which one to go to? So that is a challenge, but we are going to
Mhm.
be recording the breakout sessions first. So for those who are registrants who are at the symposium, they'll be able to watch the recordings afterwards, just for those who are registered.
Absolutely. That sounds like a great opportunity.
Yes, there's so much and so hard to choose. So it's going to be a great day. We're so much looking forward to it. And we're so glad, Nadia, that you have brought in your wisdom and your expertise as we planned for this day, which I think is going to be great. And so this program, the symposium, will be on March 21st, William Patterson University in Wayne, New Jersey, and we're really looking forward to it. So if for anyone who'd like to register who hasn't yet, you can go to pmch.org. Under the Center for Clinical Impact, you can learn more about the agenda, read the bios of the speakers, and to get your ticket. So thank you so much for Nadia for joining us today and for everything you've done to make this a day of success on the 21st. And we hope to see everyone there.
Sounds great. Looking forward to seeing the 21st. And it's been a team effort. And back to the old proverb, together we go further. Thank you for having me.
Thank you so much. Take care.
Bye bye.